Dr. Abdulrahman Duaij Muhoorfi, AGU graduate 2020, currently an intern at King Hamad University Hospital and a part-time tutor at Arabian Gulf University. Also, he is a certified trainer from the Highfield Center from the United Kingdom. His passion is toward assisting medical students by providing the guidance through their journey in the medical school.
So good afternoon, everybody. My name is Abdulrahman Duaij. Thank you first of all for this opportunity. So today I'm going to speak briefly about how to choose your specialty in medicine. So the first question for me is why I have chosen this topic. So this is a problem that currently many doctors and medical students that are facing now. So there was a study that have done in the United States of America, like they chose 12,000 doctors, and they saw the satisfaction. They did some questionnaire and they asked them about the satisfaction in their specialty. And the result was surprisingly that only 20% of all doctors, they were completely not satisfied about their current position. And only 40% of them that having the optimum satisfaction, and 40% that are in between. So also I was questioning myself, which field is better for me, or which field is suitable, where I can be in the best place. Is it like pediatric? Is it surgery? Is it medicine? So there must be a solution that I can really choose what is the suitable field for me. I was discussing this topic with a friend of mine, and he gave me a book. It's called Career of Medicine, and it was like regarding this issue. So I have summarized the ideas, the main topic or main things that was in this book, and it was very useful for me. Okay, so when you are a student, we are facing like 6 or 7 difficulties regarding or choosing like what is the better or what is a suitable specialty that we will be in. The first thing that during the clinical years, we have a lot of time considering or for studying, not or for examining, not for thinking about which specialty is good for us. The second thing in the real clinical years, we don't have that much exposure. Like all of that time, maybe we are in the clinic, in some rotation we are sitting with a doctor to discuss some topics regarding that field. Sometimes like in the surgeries, we are having less hands-on, we are like only observer, or even like we have scrubbing, we are only having retractors. Some rotations, they are only doing paperwork. So the exposure will not give us that much idea about the atmosphere or the real work in that field. The fourth thing that we don't have all time for all rotation. We know that we have like limited rotations, like the major one and like some of the minors, but we don't have like for domestics, we don't have like for physiotherapy, pathology, microbiology, genetic. So we don't have an idea. So that will narrow our opportunities, or will narrow our thinking about what are the thing that we have or we are able to go in the future. One of the main things that also we have difficulties or we have wrong conception is that we have wrong way of thinking about the right field or that specialty. So sometimes you will see, I will go surgery. Why you are going to surgery? Because I got a grade mark. Or I don't like pediatric. Why? Because in the clinical years, I didn't get a good grade student. Or I will go to that special area because I like that doctor, or I like that team. Or my parents from the beginning, they wish that I will be that and that. So that's why it's not the right way that we are supposed to think or are supposed to choose our specialty. And the last point, we don't have a career advisor. So in some of the universities in United States, they have some person, like a specialized person, that the students, they can go and discuss about what are the opportunities, what are the right field for us. And they have some like advising or guiding for the students. Okay. So maybe a person will say, so what will happen if I choose the wrong or I didn't think about it? For the first thing, it will be in worry or concern until maybe the last day before like choosing the right field, or like after internship, you will think, okay, what I have to do. So you will be in worry, concern what is the right field for me. The second thing will be maybe sometimes you have delay in a career. Some students or some doctors, they will go special field, stay 1 or 2 years, and they think, no, that's not the right place for me. I will not continue. So then they will switch to another area. And those 1 or 2 years, they really matter in medical school. The third thing, the wrong decision. As I told you, like in the study, living with dissatisfaction, living with depression, least achievement, it's not the right way to live. You will not stay in that field like for 1 year or 2 years. This will be your field for all your life. Okay, and also the quality of the patient care will be affected because you will not get up the morning every day to go to a place that you don't like, to type of the patient you don't want to take care, and you will give it the much care or the best care that you will give it for anybody else. So the next question is when I have to think about it. I know like the major of the students or the participants now maybe from 5th or 6th year, but it should be started from the pre-clinical years. This thing, as I told you, it's not going to be by chance or like what is available, I will go. No, it needs some time to think, to read, to search, to ask about it. So from pre-clinical years, maybe I have the opportunity to have some clues, to have some hints that maybe that part or that field is good for me. So if you like anatomy, maybe like give you a hint like surgery, radiology, maybe that's good for you. Or maybe if you like histopathology, that maybe in the future, maybe I will be a pathologist. Maybe if you like the organism, the microbiology, the infectious, maybe the infectious part will be okay. Maybe if you like pharma, I like how I can treat. I like how like the dosing the medication. I know it's like it takes all the field, but they are like more in the medicine or pediatric part. The drawbacks or the negative thing in the pre-clinical is you have less exposure to real life or real work there, limited exposure to hospital, and we have a lot of basics to study. I know that they are the main thing that you have built on, but they are not what you are going to see really in the hospital. The next area is the clinical years. The good thing in the clinical years, you have more exposure, more experience. You have the opportunity to ask the residents there. You have to ask the consultants. You have to see like not as much exposure, but you have to see what is going there. Okay, the disadvantage I told you, there's no rotations. There's sometimes inappropriate exposure. Also in clinical years, we go to morning round. So also take an idea about what are the topics and that are discussed, what are the diseases that are like treating. Also you can give an idea, is it boring for me to listen about the doctors, the pediatric adjusting the doses for the babies, or is it boring for me to see what are the complications of the surgery, or it's very interesting for me to see what are the new guidelines. So also this will give you an idea. Other things that from first year till the last year also you can do to see what is good for you, what is the right place for you. You can attend conferences. Every year they are like conferences for pediatric, for emergency, for medicine, for surgery. You can attend and see are the topics and diseases that are interesting for me. I can also meet the physician there, meet the person, the doctors there, and ask them what is going on. Also the research. Also, all years we have opportunities to do a research and to see what are the things that I'm interested. I'm interested to see what is the relation between this risk factor and this disease or not. I'm interested in see what is the better medication for specific disease. And also doing a research will give you some stronger application chances in the future. The last thing, the elective. I like the elective very much. Why? Because when you are doing the elective, you are going to specific place, like in the summer, and specific, like I'm going to neonates, I'm going to pediatric surgery, and really see what is the real work there. Because there are no other students with you. The consultants will be more focused with you. You have more opportunity to have the full exposure. So it will give you a very good opportunity. As I told, this all some questions, like some ideas. So how I can know that this field is the better or this field? I have 10 factors for you. Okay. The first factor is the type of doctor. You have to ask yourself, what is which type of doctor that I would like to be. I would like to be a general doctor or specialist or supporter. So what do you mean by general? So general doctors, that the doctor that like the example from the family medicine, internal medicine, pediatric medicine. So these doctors have broad knowledge. They have variety or like broad age, many diseases. Okay, and they have a lot of time for caring the patient. Most of the patients are like chronic diseases.
يعني قمت بفوق الساعة أدور لا
I think
يفرح ليه استغفر الله ربي يعني هو شكله صالح شل حواليه فراشات
Aura,
هذا هني
can you please mute your mic? I think by mistake you open it. You are interrupting the presentation. Please mute your mics, everybody.
Thank you, Rekaiba. And also, general doctor, they have like some, about the guidelines, the new guidelines. They have to be updated about the new protocols of the medication, of how we are going to approach, how we are going to diagnose. Okay. Moving to the second type, the specialist. This specialist doctor, they are like covering or particularly special field of medicine or special part of the body, like the ophthalmology, the orthopedics, the neurosurgery. So these doctors, they have like narrower knowledge, not regarding like, less information, but narrower knowledge regarding the whole human. Okay. The second thing, they need more skills. They will be more skillful, and they will be like more concerning about following up the patient. The pre-operation, the post-operation, what are the complications of that? The third type of doctor, they are supportive doctors. They have a major role in like diagnosing and in the treatment, the management, but they are like supporting that, like radiology, physiotherapy, pathology, microbiology. Okay, and they are hospital-based. So this is the first thing. This is will give you hints. Am I going to, or am I would like to be a general or special or a supportive doctor? This is the first factor. The second factor is the type of the patient. Like if you are in the emergency, which type of the patient I will see? I'm going to be irritated, in pain, angry patient, or I'm going to like to something related to the emotion, like the gynae, the mother that are concerning and emotionally and stress maybe, or I would like to deal with demanding concerned parents, or I would like to be like deteriorating sick patients, chronic patients, like oncology and medicine. So the type of the patient will really matter, and like which type of the patient that would like to take care of it. The third thing, the patient contact. Am I like to contact a lot of number of patients or small number of patients? Like, do I like daily to see a lot of patients, take care of them, answer the question, or no, I would like to be isolated from them, like the pathology, radiology, microbiology, they having less exposure. But the family medicine, the emergency medicine, they are seeing the many patients during the day. Okay. The third factor is the fourth factor is the lifestyle. It's very really matter. Are you prefer to have more family time and personal life? Do you need that free time for other interests? Do you like to having like your own business, to have free time to do your own hobbies, or like you're like comfortable with doing all of the time or over your work in the hospital? Do you like to have shifts or fixed schedule? Like in the emergency, they are doing shifts. But like in the family and like, and the medicine, pediatric, they are doing like everything they're having, they have to go to the work. So also the lifestyle, the type of the work that you would like to do is really matter in choosing what is good for you. The fifth point is the prestige and status. A lot of the people that they think like in specific type of doctors, they are having the high prestige. Like sometimes we hear, I would like to be an interventional cardiologist because this is the major thing for me, or I would be neurosurgeon, or I will be family physician that will help or like going to treat all the patients or meet all the members in the community. So also the type of prestige or status or the social experience is very good for you. And also you have to ask yourself a question: which specialty I'm going to be happy and satisfied in? That's very good, important question for you. The sixth thing is the content and skills. This is where like the part of our clinical rotation, the part that material that we study is very important. And as I told you also regarding the preclinical, which material they have interested in learning and memorizing and like searching about it. It's very neat because during the residency years and the fellowship, that's the like disease that you're going to study and read about it. So the content and materials is very important things because you will deal with it, as I told you, all of your life. And also the clinical skills, which skills that you are interested in, which skills that you are talented with. Is it suturing, or is it like the physical examination, or is it like you have a good eye, like very hand for talented and like in the ECG or the X-rays. So this is also important for us. The seventh point is the length of residency program. Some person that they say like I only do like to do 4 to 5 years only residency because I have other plans in my mind. Some others will say it doesn't matter for me how many years. So the years also give you an important point or important factor that you have to see. But you have to put in your mind that there is subspecialty. There is like fellowship years. So if you are doing 6 years like in neurology, maybe after that you will do maybe 2 to 3 years more over that. So you have to see the whole length. But put in your mind that all these, the 8 years or the 9 years, they are temporary. Once you have finished, then the lifestyle or the amount of time will differ. Okay. Also,
I really believe, Doctor, these all factors are very, very important. And you mentioned a lot of important aspects that the students should put in mind. And we also could share the presentation with them if they really like to read more about it. We really appreciate your talk, Dr. Abdulrahman. It was a pleasure to have you. And you may end up, please, with the last talk.
Okay.
You have 1 minute.
No problem. Okay. So just to sum up, okay, and just to put in mind about the future income, the residency, and the personality. So I will give you, for the personality, I will share a link with you, okay, in the chat. Okay, this is a test that you can do, okay, and to see there are some questions regarding your personality type. After that, it is important for you, if you would like to capture this slide, the type of the pattern in your personality maybe is suitable in specific field of medicine. So you can capture that, and after doing that test, you can see which field that you are good in. This is the last thing. So thank you very much for this opportunity. I thanks again Dr. Haifa and the university for this opportunity. I hope my speech was helpful and I gives you some like information that you would like to think about it. If you have any question, maybe you can ask in the chat. Thank you very much.
Thank you, Abdulrahman, so much.
Thank you, Dr. Abdulrahman. Very useful and informative. We really enjoyed it. Allah يوفقك.
Thank you very much, Dr. Haifa.